everyone, and welcome to another insightful episode of MedSynapse podcast series. Today is a very special edition of this podcast. I'm your host, Hetvi Shah, and today's episode is not just informative, but crucial for all of us, as we are marking World Heart Day today. This day is a reminder that heart health is everyone's responsibility, and there's no better time than now to talk about preventing coronary artery disease, a condition that affects millions worldwide. And to address this issue, we are joined by the esteemed Dr. Pratik Giri, a consultant cardiologist at Dr. L.H. Hiranandani Hospital in Mumbai, with expertise in intervention cardiology, 2D echo, and complex congenital heart disease management. Dr. Pratik completed his postdoctoral super specialty in cardiology at the prestigious Lokmanya Tilak Medical College and was awarded a gold medal in internal medicine. So welcome Dr. Pratik, and it is a pleasure to have you here.
Thank you so much for having me, and very good morning to everyone on this World Heart Day.
Yes. So now, Doctor, let's dive into coronary. This is something that we often hear about, but so could you start by giving us an overview of what it exactly entails and its impact on global health, and also how has the prevalence of coronary artery disease shifted in recent years?
So, firstly, I would like to try and tell about coronaries, what exactly the coronaries are. So, basically, coronaries are the blood vessels which supply our heart muscles. So, heart is an organ which pumps the blood to rest of the body. So, we all know how important the heart is. But for heart to function normally, it is the coronaries which supply the blood vessels, the nourishment for the heart itself. So whenever something occurs, whenever there is blockages in these arteries, what would you call it, the coronary artery blockages, the heart does not get enough blood supply. That means the heart does not get enough nourishment to work normally and function properly to supply blood to the rest of the body. And that's why it becomes very important to know about the coronary artery diseases.
Yes, actually, that is very important as well. So, also, it is so alarming to hear the widespread of coronary artery disease.
Yeah, and especially when we talk about the spread about the coronary artery diseases, I would love to tell you some data, the recent data. So globally, what we speak, so this is the recent data published in the JACC article, which is a very well-known American article. Globally, at present, around 350 million coronary artery disease patients are there. And this number is going on increase step as we speak. The most important thing is initially it was considered as a disease of Western population because in India and the Southeast countries, it was the communicable diseases like dengue, malaria was more pronounced than heart attacks or diabetes or hypertension. But the lifestyle has shifted now. So the shift is such big that now India and the South Asia and Central Asia rather has becoming as an emerging burden of these coronary artery diseases. Especially speaking about India, it has become one of the largest burden of a coronary artery disease when we speak about overall India. At present, India, every around 1 out of 10 adult is suffering from some form of coronary artery diseases. And when you speak, and as we speak, the Western countries now they are on the other shift. They are going towards decreasing trend. Since 1990, now it is shown that they have reduced around 16% of the burden of the coronary artery diseases. And while we, the Central Asian countries, are going on increasing the burden because of the change in the lifestyle that we are having.
Yes, that is actually so truly said, and also the rate of younger generation getting it is higher, I feel.
Yeah, because of the lifestyle that we have acquired these days, especially some addictions, the fast food nature, culture they started. This has becoming an increasing trend, especially for countries like India now.
Yes, definitely. Now, as we talk about the risk factors, so there are so many that we hear these days, like smoking or high cholesterol, hypertension. So, what would you say that are the most significant risk factors for developing coronary artery disease, and how do you prioritize these when assessing a patient's risk?
Yeah, that is very important for everyone. It has to be a smoking. Like nicotine has the highest burden when it comes to addictions. When it comes to India, every one in fifth person in Indian population, around 20% is a tobacco burden, and this is one of the very major risk factor for the coronary artery disease. So tobacco cessation has to be the priority first. Apart from the rest, the lifestyle modification when it comes to the obesity, which is emerging again a big problem in Indian countries like India, especially the normal BMI, which was average around 22 to 23 in the population, maybe 2 decades back. Now it has gone to up to 25. So obesity is becoming a very big problem. Dyslipidemia. When we talk about dyslipidemia, it does not have to be related to the obesity. Indian population especially has a very different set of lipid profiles, what we say, the cholesterol levels. There was a study done by the ICMR, Indian Council of Medical Research, showed that 75% of the Indian population has at least one of the parameters of the lipid cholesterol level is abnormal. That is 75%. It does not have to be related with an obesity. Even a thin-built, normal-looking adult can have a high level of triglycerides or a high level of cholesterol or a low level of HDL. So it is that common. Secondly, the lifestyles. Our lifestyle has started to become very sedentary. The long office hours, the stress, reduced sleep, the diet that we consume, the change in the timings of your dinner and lunch, less amount of adequate sleep. So all these changes are going to affect your health in such a way that it increases the chances of happening coronary artery disease more and more. And especially the prevalence of diabetes and hypertension in Indian population. 1 in 10 adult more than 40 years of age is diabetic in India, and 1 in 5th is hypertensive. It has that high prevalence. So these are the very important and major contributing factors to the coronary artery disease, because we don't see it that often that the people are aware of these hypertension and diabetes. They don't screen for it. So by the time they know it, it has been there for at least 3 years, 4 years, 5 years, and they do a lot of target organ damage in these duration. So these are the very important risk factors that we are dealing with now.
Now, I think it is so necessary to spread the right information and early detection of the diseases.
Yeah, that is the very most important thing, to screen for these things now.
Yes, that is very true. So now, as you was mentioning about the lifestyle interventions, so what lifestyle changes make the most significant impact, and how do you encourage your patients to actually adopt to these changes?
Actually, when we speak about the lifestyle modification, it's not very difficult. We don't have to do a lot of changes. As an Indian culture, we actually have a very good healthy lifestyle. It just recently we have moving to another. So that trend has to stop. So what our elder ancestors used to say, try to eat healthy. The fruits was a major content of our meal that is lacking now. We don't eat that much of fruits. We don't eat that much of vegetables, green leafy vegetables. Early to wake, that's what our ancestors used to say. You try to wake up before the sunrise and go for a walk. So that is very important. I tell to my patients, like, just go for a walk for 40 minutes. You don't have to do much. Go for a walk for 40 minutes, but that has to be a very brisk walk. It should not be like you go with your friends, chit chat, and come back. No, that is not going to help. You have to go. You have to dedicate that time for a brisk walking, or fast walking, or a jog. If you quantify it properly, maybe wear a wearable while going for a walk and walk for like 40 minutes at the pace of more than 4 kilometers per hour. That's a small change in your daily routine. Apart from that, just stop eating preserved canned foods, avoid eating sodas, try to reduce sugar from your diet as much as possible. Focus more and more eating vegetables, more on fruits. the dairy products. We love dairy products. Indian people love dairy products, and they have huge amount of dairy products are generally we consume every day. So these are very high in saturated fats. So we have to reduce that as much as possible. The habits of eating late in the night, that has to be stopped as early as possible. If you can have your dinner at 7 8, and try not to sleep at least 2 hours after your dinner. Maybe do some stuff, or maybe walk for a moment or for a 10 20 minutes after your dinner. So these things will help eventually for a longer term in at least preventing these diabetes, hypertension, and all the other diseases related to it.
Definitely, I think small changes can also make a significant health impact.
Yeah. Yes.
When you're talking, just a small 10-20 minutes walk after dinner also makes a
Yeah. Yes, and again, the content of the plate. Whenever we have a plate, so it has to be very precise and given equal importance. So, what are you eating? It's like what we say is low carbohydrate. Right? We Indians eat a lot of carbs. The chapati, roti, dal. That is our routine. But if you can reduce one chapati from the plate and increase equal amount of green sabji, or take an extra bowl of dal, that will be more helpful eventually.
The right amount of food is also important.
Yeah. Yes.
Now, looking at the horizon, are there any emerging pharmacological treatments or therapies that are showing promise in preventing coronary artery disease?
Yeah, definitely. See, the biggest achievement is done by the statins. So statins are the drugs which we generally prescribe to lower your cholesterol levels. So people are hesitant to start the statins very often. They do come to the OPD, they see their cholesterols are high, but they're hesitant to start the statins because of the side effects. They say, do we have to take it for a lifelong and all? But I feel these are the biggest advantages that gives to a person when they reduce an LDL cholesterol to a certain range. Especially when we talk about the LDL cholesterol, that's what we call the bad cholesterol among all the cholesterol range. So if your range is more than 100, so that is going to harm you eventually. So cholesterol crystals are the crystals which eventually land up in the coronary arteries and start this blockages process. So if you can maintain those cholesterol level less than 100, especially we are talking about LDL cholesterol, it reduces a lot of chances from starting this atherosclerosis process of forming blockages in the coronary artery. So statins are doing that since ages, and these are very important drugs in any prescription when we come across any patient who is having high risk factors for the coronary artery disease like diabetes, like hypertension, dyslipidemia, obesity. So these are the drugs which makes a lot of changes in your chances of getting coronary artery diseases. There are other things, but statins by far the best thing that had happened to reduce coronary artery disease.
Yes, that sounds very promising. Also, one more question is, like with these such drugs, do you also include the drugs that are, for example, for diabetes, the drugs would be different than the patients with obesity? So how do you manage such conditions?
So what we say is the cholesterol level or the goal for treatment for every individual is not the same. It has to be categorized for everyone. So what we say is high risk patients, moderate risk patients, and the low risk patient, and the healthy people. So those who got the risk factors like diabetes, like hypertension, or an obesity, or a family history of coronary artery diseases, this comes in the high risk categories, which are more probably likely to have a coronary artery disease. So what we say is try to target reduced level of cholesterols in this patients. Like LDL cholesterol, there has to be less than 70, not 100. For a healthy person, when we target for like 100 milligrams of LDL level, for these patients we target 70. Rather, those who have target organ damages or long-standing diabetes, suppose more than 10 years, we target the LDL cholesterol for less than 50. So what we do, we intensify the statin therapy. We add other drugs, other classes of lipid-lowering drug to achieve those targets. Like ezetimibe is there. There are some newer good drugs like PCSK9 inhibitors, which show promising results in familial hypercholesterolemia. There are some new drugs like bempedoic acid. So these are the drugs which are helpful to reduce the cholesterol levels in high-risk patients to a level which is ideal for these category patients which are high risk for the coronary artery diseases. So we have to categorize these individuals. And one thing I would love to say here is the opportunistic assessment of a cardiovascular disease. Like all those men who are more than 50 years, 40 years, and a female more than 50 years, whenever you go in the clinic, whenever you do a routine screening, try to include these tests. HbA1c level for a diabetes, a lipid level, a CRP level, renal function. So these are some basic investigation to try and get the information about it. Try to check your blood pressure, maintain your sugar levels. So all these tests which forms a battery to assess a cardiovascular disease burden are very important that we have to screen at certain ages.
Yes, that is so rightly said, I feel. Now, for patients who are at high risk of CAD, as you mentioned, care often involves like multiple specialists. So, what strategies do you find effective in coordinating care among different specialists to optimize outcomes for these patients?
So, for high risk patients, I generally say it's all about screening, early screening for the start of the process, and monitoring the levels. So monitoring is very important. Try to check your cholesterol levels every 6 months. Try to maintain your HbA1c values less than 7. And this also comes in a role of a primary physician. Whoever is your primary physician, try to be connected with them. Maybe you're not visit. Even a telepathy can help them, motivate them to screen, motivate them to walk regularly. Try to maintain adequate lifestyles, adequate food content, and the levels that we say, especially the cholesterol, lipids, and the blood pressure. So whenever you assess any patients who are having a high risk factors for the coronary artery diseases, maintaining the blood pressure to less than 130 and 90 millimeters of mercury is very important. So adequate control of hypertension and diabetes are the key factors that primary physicians seriously should look for whenever they are treating their patients. And telepathy also is very helpful because nowadays people have devices at home, so they can just screen for their blood pressure even at home. They can check their blood sugar levels and they can just give a call to their doctor that today my blood pressure is 160, which is not in the range. And accordingly, a doctor can help them. It's always not necessary to go and visit a clinic if it is not possible. But these home devices, these home care devices are very helpful in monitoring remotely for this and assessing the coronary artery diseases. These are very important.
Yes, I think digital health tools is actually a game changer for coronary artery disease sometimes.
Yeah, surely it is.
So now, finally, as we approach World Heart Day, what advice would you give to healthcare professionals who are on the front lines of coronary artery disease prevention? And are there any best emerging practices they should be aware of?
So what I will say to all is take an opportunity to screen each and every individual which comes to your OPD for cardiovascular health. Try to check their BP, try to check their lipid profiles and sugar levels. And those who got very high risk factors, try to motivate them to screen for the coronary artery diseases, maybe going for a treadmill test or maybe go for a newer modality of treatment like a CT coronary angiography and a CT coronary calcium scores, which gives more idea about the start of atherosclerosis process in an individual. So these are the recent imaging technologies like a CT angio, which is a non-invasive test. It does not take any much time also. They're very helpful for high-risk individuals. If they suspect coronary artery disease, they should motivate for these tests to their patients.
Yes, that is a good piece of advice, doctor. And now as we wrap up today's session, I would like to thank Dr. Pratik that it was an insightful conversation, and it's been an absolute pleasure having you on the podcast today.
Thank you so much, Heather. I hope we could at least enlighten to some people and help them on this occasion of hard day and try to reduce the burden as much as possible.
Yes, actually, your insights are incredibly valuable, especially as we recognize World Heart Day today. Thank you. And to our listeners, let's take this World Heart Day as a reminder to prioritize our heart health. Make those little lifestyle changes and stay informed. Remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and take care.